Chairman of the City Council's Committee on Healthy Women, Families, and Communities. We are here today to discuss docket number 0176, message in order for the confirmation of the reappointment of Dr. Myechia Minter-Jordan as a member of the board of the Boston Public Health Commission, and docket number 0305, message in order for the confirmation of the appointment of Phillomin Laptiste as a member of the board of the Public Health Commission, Boston Public Health Commission as well. First, a note of clarification. The original docket summary on the City Council meeting agenda for docket 0176 had a typo regarding Dr. Minter-Jordan's term. Her term will expire in 2022 as written in the docket, not 2020 as written in the agenda. I'm joined by my dear colleague and friend, the District Councilor representing District 2, Ed Flynn. Welcome, Councillor Flynn. Thank you for being here. As well as Heather Gasper from the Public Health Commission, who's going to start us off. Before we get into this conversation, Councillor Flynn, did you have any opening comments?
Thank you, Councillor O'Malley, and thank you to the staff, the Boston Public Health Commission, for your great work for many years in the city, in our neighborhoods on various public health issues, and I'm looking forward to continuing to work with the Public Health Commission in helping our residents and neighborhoods across the city. Thank you for being here with us today.
Thank you, Councillor Flynn. This is a public hearing, which means it is being streamed and televised. There is also an opportunity for public testimony. If any members of the public would wish to have an opportunity to speak at the conclusion of this panel, they are welcome to do so if they were to just fill in the sign-in sheet to my left. Finally, any individuals watching this online or on television can submit written testimony by mail or email. The email address is ccc.hwfc@boston.gov. That's ccc.hwfc, Healthy Women, Families, and Communities, @boston.gov. All right, we'll get right into it. Ms. Gasper, do you want to give a quick overview of the Public Health Commission and the two positions that we're going to talk about filling today?
Yeah, sure. Thank you. Good morning. Thank you for having me. And I'm here in support of Mayor Walsh's reappointment of Dr. Minter-Jordan and Ms. Laptiste for the board. Our board is a 7-person board appointed by Mayor Walsh, and the powers of the board are to adopt, amend, and repeal reasonable health regulations. The board has adopted innovative policy interventions, including numerous measures related to preventing use and initiation of tobacco and nicotine products, environmental health, and biological safety measures. And of course, the expertise that serve on our board serve to inform our policy decisions at the Commission and the work we do. So their participation and expertise are valuable to our work. We've been thrilled to have Dr. Minter-Jordan on our board now. Her clinical experience, her experience with a large health center, her experience with mental health and substance use have just been invaluable. And we're looking forward similarly to Ms. Laptiste in terms of being a resident of Bowdoin-Geneva and being part of another health center. We think she'll be a great addition to our board. So happy to answer any questions, but turn it over to our board members.
Great. Okay. Thank you. And I think we'll start with the reappointment. Dr. Minter-Jordan, did you want to give a quick overview of your CV, your experience, and also your impressions having coming up on the conclusion of your first term on the Health Commission?
Sure. Thank you so much again for having me, and I appreciate the attention that has been given to this reappointment. I am an internist by training. I'm originally from New York and did my training at Johns Hopkins in internal medicine. I came to Boston in 2007, first as the Chief Medical Officer of the Demick Center, and then became the President and CEO in 2013. Since the time that I've been appointed to the Boston Public Health Commission, it's been my honor to serve the public health needs of Boston and beyond, and really focusing, really much of my time has been focused on the tobacco initiative that was mentioned that we undertook, as well as identifying other public health initiatives for the city. As a community health center leader, I find it's incredibly important to represent the communities that we serve and to represent their public health needs. As we look at how we treat flu epidemics from H1N1, from my time in Boston, to the various public health issues that have arisen during my time on the commission. It's been an honor to share my expertise, my clinical expertise, as well as my knowledge of the communities that we serve in really trying to craft the public health agenda for the city. I have a great focus and a great appreciation for the work that the commission has done in terms of identifying disparities for particular populations, as well as the work that we've done more recently in establishing the tenets of our strategic planning and really trying to ensure that we are engaging various stakeholders in that planning process, particularly focused on the mayor's interests in terms of not only identifying disparities, but really working diligently to improve the disparities that we're seeing. The work that the mayor has done in terms of the Office of Recovery Services, I've supported. I've worked with the mayor in terms of the establishment of that office and supporting that office's integration into the commission, as well as the office's outreach into the community with various community organizations, including the Demick Center. So I'm very proud to have served on the commission and look forward to being reappointed, and am happy to answer any questions that you may have.
That's great. And which neighborhood in Boston do you live in?
I live in West Roxbury.
That's great. The best district known to man. Terrific. Phillomin Laptiste, can you tell us a little bit about your background and experience?
Sure. Good morning.
Good morning.
Thank you for having me, and I also like to recognize and thank the mayor for his appointment. So I am a lifelong resident of Bowdoin-Geneva, born and raised here in Boston. Started my early work around community engagement and outreach. That has been kind of what I've done up until the point that I got to the health center. So I've been at Bowdoin Street for over 10 years, and now in the current role as executive director. So I started as manager of community health. Very excited about this opportunity because, you know, working at the health center and also thinking about what this role means as a community resident, as someone who has family, raising children in the neighborhood that I grew up in, that we serve, is very important to me. So looking forward to, I've had a relationship with the Boston Public Health Commission during my entire time at the health center. Strong working relationships on issues such as violence intervention and prevention, trauma, food access, and really looking forward to what I can bring to the table as someone who has been on the ground and also currently serving as a leader in a community health center in Boston.
That's great. And which high school did you attend?
I went to Boston Latin School.
Excellent. So you both, you're the executive, Dr. Minter-Jordan is the CEO of the Demick Center. Ms. Laptiste is the ED of the Bowdoin Street Health Center, two of the best community health centers, I would say, by far. How many patients do you currently see at Bowdoin-Geneva? And then the same question for Demick.
Sure. We have about 11,000 patients, and we do about 45,000 visits a year.
Great.
And at the Demick Center, we have roughly 19,000 patients and families that we serve, with roughly 70,000 visits a year.
Great. Are you the biggest community health center in Boston, Demick?
We're the second largest. East Boston is the largest.
Oh, East Boston's the largest. Excellent. And, you know, I appreciate a lot of the work you talked about specifically as it's around health disparities. This is somewhat off topic, but I'd be really appreciative if you both could come back either in a formal capacity or even just to help guide us. But Councilor Kim Janey and I, the first hearing order I authored for this committee is on Black maternal health and the fact that we still have such significant, you're 4 times more likely to die giving childbirth if you're a woman of color, a Black woman as opposed to a white woman. So ways that we can address that, because not only is it the prenatal piece, but also other things. So look forward on that. And then to that point, you know, for me, and I know you guys share this, it is vitally important that we have a public health commission that values and respects every Bostonian, no matter where they come from, you know, citizenship status, you know, who they love, gender identity or expression. So can you talk a little bit about that, efforts that we can make sure that the Public Health Commission, indeed the city, I know the mayor shares this as well, has as open and welcoming a public health board, you know, as any other?
So I'm happy to start, given that I serve on the board. I think part of it is looking at the leadership of the commission and working with the head of the commission, Monica Valdez-Lupi, to ensure that her senior leadership, as well as others within the commission, reflect the community that it serves, and we do that, I believe, quite well. I think there's always room to grow within that. I think also the diversity of the commission is important, of the commission members, like myself, is really important in terms of that reflection. The open meetings that we have obviously are open to everyone, and we try to create a very warm environment and engaging environment for that. I'm confident under the leadership of our new chairperson, Manny Lopes, that he will continue to move forward in those efforts of ensuring that the public feels appropriately engaged in our conversations and that those conversations are open. We tackle a number of topics around disparities, really hitting on all of the various groups that you've just mentioned. And I think those conversations have been very much open and engaging to the public.
That's great.
Right. As someone coming in, I've known Dr. Jordan for quite some time, and also Manny Lopes as well. So going in, I know that coming on to a very strong team, heard lots of great things about the other members of the board. Looking at when we talk about disparities, that's something that's always at the forefront of the work that we do, and making sure that healthcare is accessible and also equitable. I think we all share the same struggles as we talk about, maternal fetal health, and how the outcomes of that have not been so great, and how do we move the dial on that? How do we make the change? So for me, coming in very energetic, very open to sharing, and really working closely with the commission to see what knowledge or services that I can bring to the table that would really help to move the dial on a lot of these issues that we have been struggling with in the city.
Great. Given the fact that you both have such expertise at two critical components of our public health delivery systems and community health centers, how have you seen the relationship with some of the larger scale hospitals, particularly the Longwood Medical area, Mass General, Brigham and Women, supporting some of your community health centers? I know, for example, in my district, Children's Hospital has a great relationship with the Martha Elliott Center next to the former Bromley Heath. We now call it Mildred Haley, so that's been a good relationship. Have you seen that as well, some good synergy with your respective health centers or perhaps some others?
Yeah, so Bowdoin Street Health Center is hospital licensed, so we are licensed by Beth Israel Deaconess Medical Center. And thinking back to like the stories that I've heard, I wasn't a part of those earlier conversations, but when we surveyed our patients about where they wanted to receive their care, the number one choice that they had was Beth Israel, and also for our parents, their first choice was Children's Hospital, and we have a very strong relationship with Children's Hospital. So when it comes to service, when it comes to advocating for our patients to have equal access, I have not had any issues.
Great.
And they've been pretty strong.
Good.
Yeah, I would agree. I think the hospitals have been great partners with the majority of the community health centers in Boston. I think there is room for improvement in terms of how we think about aligning the public health agenda of our hospitals and community health centers and the commission, and I see the commission in a leadership role as being able to do that, and I know that that work has already begun of bringing the various stakeholders together and agreeing on a common public health agenda for both community health centers and hospitals. But I think it's that work is founded in this principle of amazing support from the hospitals to the community health centers and to the commission, and I see us working together collaboratively in order to push forward a common public health agenda.
Great. I appreciate your work on the tobacco initiative. I think that has really been important for a whole host of reasons. Should you be appointed or reappointed, what's one sort of public health initiative that you'd like the commission to really dig deep on in the years ahead? We'll start with you, Philly.
Sure. So coming in for me, it would be our initiatives around public safety. I signed on as a validator for one of the bills that the mayor was putting forward, and that was to ask questions around gun access and just gun violence to our pediatric patients especially. So we started a pilot at the health center where we are actually looking at asking those questions in the medical visit. So asking questions like, in the past several weeks or in the past month, have you been in an altercation, or have you had any verbal dispute? And after that, the follow-up question would be, do you think that that issue was resolved? If they say no, then more than likely they might be carrying some form of protection, and then we would seek out other resources to assist. So for me, when I think of the most recent hit that our community has had, and I would talk about Jassy Correa, looking at how the community came together, not just the Cape Verdean community, it was people from everywhere. Bowdoin Street was jam-packed on Friday and Saturday with both her services. So when I think about that and how that impacts people, if you think about diabetes, the way to prevent type 2 diabetes is to exercise and eat healthy. If you don't feel safe, you're not going to go out and exercise. There's such a ripple effect when you think about public safety and other initiatives. So for me, lending my hand to that is something that I would be most interested in. And then obviously other issues around tobacco, they all connect in some way. So that would be it for me.
Okay. Yeah, that's good one. Great ones.
Yeah, I would wholeheartedly agree in terms of that being a priority for the commission moving forward. I would also add substance use disorder.
Yeah.
Clearly, that's something that continues to impact Boston as well as the Commonwealth disproportionately to the rest of the country. I know that there's already been a lot of incredible work that's been done, but we continue to see rising rates of overdose, particularly within communities of color. And so I think there's still room to grow in terms of how we not only provide access to treatment services, but also education. And I think we really, particularly with the legalization of marijuana, I think this is an opportune time for us to double down on those efforts and really make sure that we are preventing further overdoses and opioid use to begin with within not only communities of color, but the broader Boston community.
Yeah. Has the Public Health Commission weighed in on harm reduction sites or safe injection facilities?
Not formally, no.
Okay. Any thoughts you want to share?
None at this time. I think there's still more. And I think part of what I'll caveat what I'm saying in terms of we need to think more broadly about what harm reduction is.
Yeah.
I think we tend to focus on sort of the more complex topics within harm reduction. You know, harm reduction is also wearing bicycle helmets. So I think we really need to have a deeper discussion at the commission level and with the public about changing our ideas around harm reduction and not sort of focusing on the more complex issues, but really thinking more broadly about what that continuum of harm reduction looks like.
Yeah.
So I think there's those conversations are beginning, but we haven't formally.
No, that's fair. And I think we should be, you know, I'm glad at least the Health Commission is beginning these conversations because they are important. I know there's a whole host of issues surrounding them, but I know the mayor's also been upfront about talking about the need to be having this discussion, so I appreciate that. Heather, how often does the board meet?
Once a month.
Once a month? And is there a stipend for serving on the board?
There's not.
There's not.
No.
So you guys are willing to do this for a lot of
Volunteers.
work and no money, so I think that should be noted because I do really appreciate that. Councillor Flynn, did you have any questions?
Thank you, Councilor O'Malley, for your leadership on this issue, on public health issues. I know you're doing an excellent job educating and providing as much information and working closely with the Department of Public Health, and I just want to acknowledge your great work on that. In Dr. Jordan, I was interested in some of your comments on tobacco initiatives and environmental health that you spoke about earlier. I've had a chance to work closely with public health staff on an upcoming forum we're going to have in Chinatown on public health related issues, including tobacco, environmental health concerns. So your staff, the public health staff has been excellent in working closely with me. But the community in Chinatown has one of the highest cancer rates of any neighborhood ethnic group, Chinese community. In Boston, they have the lowest screening woman for breast examinations of any ethnic group, high smoking and diabetes rates. So I'm looking forward to continuing to work with your staff on the upcoming forum. But, you know, Chinatown is surrounded by, you know, the Mass Pike and surrounded by the highway system. And we see our young kids, students at Josiah Quincy School that are exercising, playing in the schoolyard right off the Mass Pike. They're breathing in those fumes, unfortunately, all the time. But do you have any thoughts about what is currently, how we can be more effective as it relates to these environmental concerns in various neighborhoods?
I do think the commission can continue to take on a leadership role in health and all policies. And as we think about policies that impact where, you know, highways are placed, or where streets are placed, or where different businesses are placed, to really continue to push forward with the health and all policy, that there is a recognition of the environmental impacts of these types of decisions that we make. And the commission has made some great strides, particularly in pediatric asthma around that. And I think that there's still, we can continue to take that position on as a leadership role in really pushing not only in housing, but also, again, in terms of how we're thinking about communities and the development of those communities.
Yeah, and as an example, I know South Cove is doing a lot of good work on public health issues, but I was discouraged when I did find out that Chinese women had a low examination rate. And we're across the street from Tufts Medical Center. I think we can be doing more work on that issue, especially for our immigrant community, for people in public housing. But I know that's something I've been working with Heather on, and that's something that's been a focus of mine going forward.
One of the leadership positions that the commission has taken in terms of understanding the health of Boston is being able to, and part of why I was really excited at our last commission meeting to understand that our Health of Boston is going to go online, and the opportunity to look at data and to slice data in different ways, and particularly around geography, and to understand what the impact is of certain disease processes in various communities. We can link that information and provide data around that and share that with our hospital partners, as I talked about earlier, bringing the hospitals to the table as stakeholders, and creating a common public health agenda with that level of data can help to drive more mammogram screenings, more education in communities that are disproportionately impacted.
Okay. And Philly, thank you for your leadership on so many public health issues as well. I know you're active in the community health system. The opportunity to visit the South End Community Health Center yesterday for a tour and to meet with some of the staff there. One of the concerns they were expressing to me is a lot of the cuts from the federal government in reimbursement rates. They're actually cutting a program, unfortunately, that's doing tremendous work on behavioral health issues for kids. And the issue was that because of the coding system, these young kids didn't have the diagnosis of a behavioral health issue. So they were working with these young people on these issues, but because of the coding system, they weren't able to get reimbursed on it. Because it wasn't an official diagnosis at the time. And I think it was a cut of $75,000 to the South End Community Health Center. But are you seeing some of these types of issues around various health centers across the city?
Yes, and I can speak to it a little bit. So Bowdoin Street is hospital licensed. We're not federally qualified, so we do not go directly after federal dollars. But as it relates to behavioral health, yes, there is a concern that if the coding, the diagnosis. So one of the things that we have had to seek grant funding for is what we refer to as behavioral health integration. And so while there aren't formal diagnoses, when we look at our patient population as it relates to behavioral health, our patients come in, it's episodic. They don't come every week for a visit for the course of a year. We may see them about 4 or 5 times when they're in crisis mode, and then they'll drop off, and then they'll show back up again. As it relates specifically to the integration piece, is something that we have a licensed therapist, a social worker who is on call, that in the middle of a primary care visit, if the provider sees that there's a need, or the patient expresses that they are depressed or there are other issues going on, we can have a social worker come in during that visit and have a conversation with them, and at that point do an assessment about what would be the next step. Would they benefit from long-term or short-term intervention? And that is something that is not reimbursable. So I think many of the health centers are doing some form of behavioral health integration, and we're not getting reimbursed for it, but we do see it as a need for our patients. So we do whatever it takes to make sure that they're well.
Yeah, thank you for that. Thank you for that answer. I know you also talked about food access programs. What is public health doing on that issue as it relates to our immigrant community and people living in public housing?
Right. So the HIP, I'm going to mess this up, but I know that there were HIP dollars, SNAP benefits, double your money. There have been a lot of initiatives around education, outreach to make sure that people know that these dollars exist. I think that there's several 100,000 people that are, or that qualify for SNAP benefits that are not getting it. So one of the approaches is one that they've been doing a lot of education. They've been coming out to the farmers market. Bowdoin is, I know, one health center that has a farmers market or farm stand on site. So we do have education and information for our patients to let them know that these services are available to them and how to access them. Other areas and things that they've done are making sure that they do strategic outreach around coupons or vouchers for seniors, especially. In our neighborhood, we do have one senior housing, and that's on Bowdoin Street. It's called the Pashuco House. We do extensive outreach there. We partner with the Public Health Commission to do that as well, and make sure that people know that these resources exist. I think that's one of the biggest issues, is getting the word out. I think people, if language barriers are also an issue for folks, that they may not understand what supports are in place for them. So we've partnered with them because of the language capacity for the health center to make sure we get the education out there.
Yeah, I was always impressed with the health center's commitment to our immigrant community, people living in public housing. I see it in all of my health centers, including South Boston does a tremendous amount of work in public housing, which is critical and important. And just one final issue is I'm working on a upcoming hearing with the City Council President, Andrea Campbell, on domestic violence. Do you have any thoughts, Doctor, on what we can do to improve our outreach to, when I was at the South End Community Health Center yesterday, I was asking them about the young boys that see domestic violence in their own homes. And is there a likelihood that these young boys, when they grow up, will also, unfortunately, be domestic abusers when they get older? So is there any type of outreach that we can do or continue to do with the school department on helping young boys get the counseling that they need so that these issues won't be prevalent when they get older?
Sure. So I think some of the things that we do at the Demick Center is that we screen every patient for domestic violence, and that includes the parents, the adults, as well as children. So part of it is asking the question, which then opens up the conversation. From a prevention standpoint, is working with the school systems. Those that do have counselors on site, those counselors sometimes are overwhelmed by the sheer numbers of children that they are caring for, is understanding that there are resources within the community health center system to connect those children to. Philly spoke of this a bit, but the behavioral health integration piece that we have at the Demick Center in terms of having psychiatrists as well as counselors and pediatricians working together within the same clinic, sharing the same information about patients, also helps to make sure that we're capturing all of the behavioral health needs of the people that seek care with us. But I think part of it is education and access to treatment, as well as opening the conversation and helping to reduce some of the stigma associated with discussing abuse within the home.
And I just wanted to add to that, I think one of the things that make community health centers unique, which you probably already know, is that we see generations of families. And so that trust, first and foremost, we can screen as much as we want, but if there's no trust between the provider or any staff member, it would be hard to get that information and hard to move forward with any sort of support if that trust is not there.
Thank you for those comments, and I just want to say thank you to both of you for being here, but more importantly for your leadership on public health issues for many years in our city. And Heather, I just want to say thank you to you and your staff and your team for the tremendous work and cooperation you are giving with all city councilors and residents of Boston on these critical issues. And I know we're going to be going into the budget season very soon, and if there's anything I can do to be helpful to public health, please let me know. I'm sure Councilor O'Malley feels the same way. We have a great deal of respect for the work that you're doing across the city. So we're here also to be helpful to you and your team as well.
Thank you.
Thank you.
Thank you.
Thank you, Councillor Flynn, for those great questions. All right, the last question I will have is I want both of you to talk about somebody that inspired you to get into this line of work. It could be a professor, it could have been a doctor, it could have been some other public health professional, but just someone we may know, someone we may have never heard of. So we'll start with you, Dr. Jordan.
Well, I would love it if you'd heard of her, but it's my mom. So she lives in North Carolina. So my mother was a nurse for 35 years in Queens, New York, and really introduced me to healthcare. And as a nurse, her spirit of giving to her patients everything that she had was really inspirational for me. So I would definitely
That's
say
great.
my mom.
And I'm sure she is so proud of you.
Thank you. Yes.
And for me, it would be an experience that I had with my daughter, which is how I got to Bowdoin Street. I'll spare you the details of the story, but she did ingest a high blood pressure pill while being cared for by both my parents. And walking into my mom just bringing her to Bowdoin Street because that was what she knew, and the care that I received there, not being a patient, even though I literally lived down the street from it. We actually, ironically, my family, when they first migrated from Trinidad, they lived in Roxbury, so Dimmock was our health center. So she brought her into Bowdoin, and for me, the care that we received there that day, being asked to come back for a visit, being called that night while at Children's by one of the pediatricians, Dr. Bonacci, saying, "We'd love to meet you, please bring your daughter back." Going there, running up, having her run up and down the halls, them giving her stickers and books and just saying, thank you, I'm glad she's okay. And then happened to see a posting for a position at the health center. I was like, no way, this is not real. So knowing that that type of care exists in a community that anyone can go to and have access and be cared for with compassion and, the highest level of care really did something for me.
Wow. And had you been working in healthcare before you applied?
So I worked at the American Diabetes Association, and my dad was a diabetic. I lost him to diabetes several years ago, and that was the start of it for me. I knew I wanted to do work in the community, but I wanted to do meaningful work in the community, but I just didn't know what that was. And that until I had that instance at Bowdoin Street, and I was like, yes, this is it.
Wow.
Yeah.
Well, those are wonderful stories both. So
Thank you.
I cannot thank you enough. I will be forwarding these with a positive vote for the committee and then hopefully the full council,
Thank
if not
you.
tomorrow. Tomorrow or next Wednesday, whatever the time frame is. But really appreciate both of you for doing this incredibly important work for no money, no glory, other than you both are true public servants in every positive sense of the term, and I'm very grateful for you both. As we are grateful for you too, Heather Gasper, for the great work you and your colleagues do on the staff at the Public Health Commission. So unless there's any public testimony, which I do not see, I will hereby adjourn this hearing on dockets 0176 and 0305. Thank you, Dr. Myechia Minter-Jordan. I will be recommending your reappointment, and thank you, Phillomin Laptiste. I will be recommending your appointment as well.
Thank you.
This hearing is hereby adjourned.